Welcome back. Children suffering from burn injuries can now receive faster and more thorough care. Singapore's first dedicated paediatric burn centre will shorten treatment and waiting times for patients under 16 years old. With streamlined processes and better infection control, the unit will be crucial in shaping the children's long-term recovery. Nadine Yam with more.
Julius Lim was just 7 years old when he was rushed to hospital one night after being scalded on the chest with hot water. He was in the kitchen alone, getting himself a glass of warm water.
I saw his skin were like curling up, but it wasn't clear, apparent, like that was kind of from the burn. I thought that, maybe he was very dirty after dinner. So then after that, we realized the situation that it was actually his skin that was kind of burned by the hot water, and it was curling up immediately in front of us.
Every year, the KK Women's and Children's Hospital, or KKH, sees up to 400 new young patients with burns like Julius. Last year, over 70% of these burn injuries were from the scalding of hot water, soups, and beverages. The remainder suffered contact or friction burns. Now, a paediatric burn centre at the hospital aims to provide faster care to these patients.
Previously, all our burn patients had to be seen at our general paediatric plastic surgery clinic, the Cleft and Craniofacial Center. And as the name suggests, a lot of the children are there with other conditions. And this leads to longer waiting time for our burn patients, waiting for their dressings to be changed. Now they just come here. There are no other competitors for the space. So they can get seen and their scrub downs can be done more efficiently.
Here at the new KKH Pediatric Burn Centre, you'd notice the playful, brightly lit interiors. Designing the centre this way was completely intentional to comfort and soothe the anxiety of a child as and when he or she walks in with a burn injury. KKH is the first hospital outside of North America to be certified as a child-kind institution for pediatric pain management. This means ensuring every touchpoint is pain-free and fuss-free for the patients and their caregivers. With all the support in one facility, it will significantly improve the children's physical and mental healing after their traumatic burn injuries.
And to tell us more, we have with us Dr. Gale Lim, who is the head and senior consultant at the Department of Plastic, Reconstructive and Aesthetic Surgery at KKH. Dr. Lim, welcome to the show.
Thank you.
Now, first of all, let's start with why is it necessary to have a dedicated pediatric burn unit? Why is there a gap for this?
I think that we have been treating pediatric burn patients all along in KK Hospital, but at our general pediatric plastic surgery clinic. And as you saw earlier, it can be pretty crowded because it's called Cleft and Craniofacial Center, so we have a lot of cleft babies. We do a lot of feeding there, counseling, and as well as a lot of other traumatic injuries are being treated there. So our burns patients end up having to wait a longer time for their treatment. So now with this new facility, it is actually housed next to our children's intensive care unit, which is where our severe burns will be housed as well. And at the same time, it's on the same level as the main operating room complex. So we can actually leverage on all these services to help our burn patients get the best care, integrated care that they need.
So what is the difference then between treating an adult burn patient and a child?
So adult patients can actually tolerate painful procedures, moderately or minor painful procedures, and they understand what's going on. But for children, it's really very difficult for them because there's a huge emotional component attached to the pain. So we want to reduce all that psychosocial trauma associated with the experience, especially when children have limited understanding of what's happening to them, especially looking at our largest group of patients who are burned, which is like from 0 to 2 years old. They're really just toddlers. So it's a very frightening experience for them. And hence, we have to use a lot of sedation, general anesthetic, and also use other distraction methods like art, music therapy, and child life specialists to come and help calm them down. Of course, with our new facility, as you can see, the decorations make them feel like they're coming to a happy playground. So that helps to alleviate the fear or the stress. And also, this shows our dedication as well to the caregivers that we are committed towards a child-kind sort of experience for them.
Can you walk us through a little bit, as we walk into, we saw earlier a very friendly, cheerful-looking area that a child would first be initiated into that treatment. Can you tell us what that process would be like, let's say from a child's perspective, experiencing that?
Yeah, so they walk in and they feel like they're at an amusement park because all the cartoons on the wall are very bright and friendly. And also, they probably know that they're going for a dressing change and anticipating that pain or their anxiety. So by shortening the waiting time for them, this will help to alleviate their pain or stress. And I think that will be helpful as well.
Yeah, and there are also some specialized new setups that are installed there. Can you share more about that? I hear there are also these specialized shower beds. Can you tell us more about some new features?
Yeah, so previously we had 2 rooms that were shared by all the patients in plastic surgery, but now we have 2 dedicated rooms with adjoining procedure rooms for our burn patients. On top of that, for massive, extensive burn patients with a lot of bandages, they may not be very mobile, so it's very difficult to get a shower, a thorough shower for them. So we have installed a shower trolley that's movable, so that allows us to now ergonomically wash them down and effectively clean them up, and they can still remain comfortable under general anesthetic. So this is really one of the key features that we are very proud of.
And on top of that, you also mentioned earlier the child life art and music therapy programs. How will that help to enhance that experience and also to take some of the stress and the anxiety away when the child is there?
So having this fun experience attached to the entire experience of the burn treatment hopefully reduces the psychological trauma that they undergo. And this will help long-term as well, because right after the healing process, they'll have to go through a period of rehabilitation for their scars. And so this really helps to mitigate all that fear and the the avoidance that happens after the healing process.
Well, you mentioned earlier, Dr. Lim, the idea that actually a lot of the burn victims, if not most of them, are actually 0 to 2 years old. So that might be quite surprising to some viewers who hear that. Actually, what are the most common causes of burns in the patients that come into you in that age group?
Yeah, actually, it's not so surprising to us. This group of patients are toddlers, so they are very curious about the environment. So they go around exploring the environment. And for caregivers, if they didn't anticipate the child's movements, they'll leave hot beverages around. So commonly, the children will pull these beverages onto themselves unsuspectingly. So for me, I think the biggest takeaway is to not have hot beverages lying around. And for me personally, a cool tip would be to put 1 ice cube into your hot beverage if you're going to have it around toddlers, so that even if they spill it onto themselves, it's actually not hot. And secondly, 40% of these home accidents happen in the kitchen, and you can imagine there's a lot of hot water around. So keeping them out of the kitchen would be a very good idea. Keeping pots and pans, shiny utensils out of reach of children, putting in the inner hob would also help. Dangling wires that are attached to electrical appliances, keep them away from kids of that short height will also be helpful. And finally, I think one very important takeaway is that we find a lot of caregivers are saddled with a lot of duties, so they have to clean, cook, and also look after the kid. So I feel that if there is better delegation of duties, if there are other adults in the house that can help to do some help with the teamwork and supervise the toddler, I think less accidents will happen. And I think this is not emphasized enough.
Yeah, so these are some preventive measures. But very quickly before we go, if you can share, in the immediate aftermath, let's say, unfortunately, a burn accident has happened. Before getting to the hospital or to the burn unit, what can parents or caregivers or anyone in the vicinity do in the immediate aftermath of the burn? To make sure it doesn't get worse?
I'm glad you asked this. This is a fantastic question, because this is something that we have been working very hard to educate the public on, which is first aid for burns, and that is simply irrigation under tap water for 20 minutes. And if you institute that within the first 30 minutes of the injury, it will be the most beneficial. And you can do it right there and then. And so this is the most helpful thing, and we want everyone to know that.
Yeah, it's been very useful information. Thank you so much, Dr. Lim, for coming in today and sharing your insights with us. I've been chatting with Dr. Gale Lim from KKH.